Welcome back our fans. Internal derangement. Definition: abnormal relationship of the articular disc to the mandibular condyle, fossa, and articular eminence, interfering with the smooth action of the joint. Dolick 1983. Etiology: 1. Acute trauma to the mandible due to exposure to external violence. Trauma may cause weakening or tearing of the collateral ligaments. 2. Microtrauma of the TMJ accompanying MPD. 3. Bruxism, bruxers and clenchers, whose activity is with teeth and occlusion have hyperactivity in the superior head of pterygoid muscle, which usually put the meniscus mechanism under tension. Disc displacement disorders. Anterior disc displacement with reduction. Disc position is positioned anterior and medial to the condyle in closed position. During the opening, the condyle moves over the posterior band and eventually return to the normal position. During the closing, the condyle slips posteriorly and rest on the retrodiscal tissues. On clinical examination: pain, clicking, normal opening or slightly limited. Anterior disc displacement without reduction. Disc displacement cannot be reduced. Condyle unable to translate to its full anterior extent. Prevent maximal opening and cause deviation of the mandible to the affected side. No clicking. Treatment. Treatment of internal derangement. I. Conservative treatment. 2. Surgical treatment. Auto-reposition splints, superior reposition splints, anterior reposition splints. Conservative management. A. Splint therapy. B. Arthrocentesis followed by splint therapy. C. Arthroscopy followed by splint therapy. Splint therapy. Arthrocentesis. Arthrocentesis is a rapid and safe method to treat anterior disc displacement when other conservative methods fails. Mechanism of action. 1. Symptomatic TMJ is often accompanied by accumulation of inflammatory mediators within the synovial fluid. 2. The goal of the arthrocentesis is to lavage and lisa the joint space and remove theses mediators so it is necessary to adequately irrigate the joint. Arthroscopy. TMJ arthroscopy is used for both diagnostic and therapeutic uses. Trocars are used to enter the joint space and perform the following procedures. 1. Arthroscopic lysis and lavage. 2. Arthroscopic arthroplasty. 3. Arthroscopic removal of adhesions. 4. Capsular release. 5. Disc repositioning. Surgical treatment. 1. Relocation of the anteriorly displaced disc. A meniscorrhaphy, the meniscus is secured and tightened to the TMJ capsule. B. Meniscoplasty. I. Transection and plication of the posterior attachment of the meniscus. 2. Plastic reconstruction of tears and perforation. 2. Meniscectomy, total removal of the disc. 3. Meniscectomy with graft reconstruction. Autogenous graft, e.g. dermis, auricular cartilage. Temporalis muscle alloplastic graft, e.g. PTFE, silicone. Thanks for watching and support us by likes and subscribes.